Hi friends, my name is Dr. Madison Szar and I've been a pediatrician for 2 years now. One thing that sort of brought me to pediatrics, so I went through a lot of different iterations of what I was going to do in med school. I always knew I wanted to be a doctor, but going into med school, I was convinced I was going to do psychiatry because mental health had always been something that was really important to me and interesting. But then going through med school, I had really gravitated towards my pediatrics rotation. Kids are just so resilient and you have so much potential to impact their lives at such a critical stage in their development and make really lasting impacts for not only them, but also for their families. So lots of times with younger kids, it will often come up with issues at school. Is very frequent, getting in trouble at school, being disruptive at school, and those behaviors may also translate to when they're at home. And then we can really delve into what exactly is going on and why is it going on? Is this going on because of something like ADHD? Is this going on because of something surrounding like anxiety at school? Because that's the first step, is really figuring out like what the diagnosis might be so we can lead to the best treatment. Yeah, so my mom owns a daycare. One thing that really helped show me too was like seeing firsthand like kids developing over time and coming into their own personalities and their own likes and dislikes and basically, growing into, individual humans with their own interests. And it was something that was really special. And then my stepdad is a middle school guidance counselor. And so that definitely talks around the dinner table, helped get me interested in adolescent care and adolescent mental health. And also recognizing that as a school system and resources within the school, like they do so much and teachers do so much to help support children, but oftentimes there's more that we can do as other members of the community, as their doctors, to help advocate for them and help get them support that they need. So it's definitely helped shape, what I imagine my practice to be and sort of my tenets or thoughts going into practicing care for children. So one thing with Bluebird Kids Health is their whole kid model, whole kid care. And the idea behind that is that you can go to any doctor to treat a cold. But one thing that brought me here is the focus on the whole kid and the focus on how the mental strains and mental health development impacts a child's performance. It impacts their whole life, and really being able to make that a priority when we're in the room. So at Bluebird Kids Health, our goal is to provide exceptional care so every kid can thrive.